If the patient is in dorsal recumbency, all 6 fast exam transducer locations can be easily accessed. Organs and effusions tend to settle into predictable locations. The fast exam for effusions should only take a few minutes. If effusion is present, note if it is mild, moderate, or severe in each location and get a sample of the effusion for analysis. If the patient is in lateral recumbency, 4 of the fast exam locations are easily accessed and the downside will not be. To access the other 2 locations, the patient must be rolled to the other side. Rolling the patient could increase stress and cause the effusion to change locations. As an alternative, the patient could be placed on a cardiac table. The patient can be gently moved so the last 2 fast exam locations are over the hole in the table, and the transducer can be placed under the patient for the last 2 fast exam locations. If a cardiac ultrasound table is not available, or the patient is too large to fit on the cardiac table, a gurney can be placed perpendicular to an exam table, leaving a gap between the 2 tables. The patient is positioned in lateral recumbency with its heart or right upper abdominal quadrant over the gap between the 2 tables, and the ultrasound transducer is placed on the ventral thorax or abdomen between the gap in the tables. Patients in respiratory distress presented in a sternal recumbency position should not be forced into a lateral or dorsal recumbency position. In the sternal position, 4 fast exam locations are easily accessed. If skin sags or hair is in the way, the assistant can pull the patient's skin to move hair out of the way. Again, the other 2 locations can be accessed if a cardiac table is used, and the patient can be gently moved so the last 2 fast locations are over the hole in the table. In the standing position, all 6 fast exam locations are usually accessible. The patient may have more of a tendency to move about in this position.